Edwin Williams, and this is our fireside chat on a question that I'm often asked about rhinoplasty. How do you get a natural nose, and what is a scarless rhinoplasty? Well, basically, there are two approaches to rhinoplasty. There's the open approach, and there's the closed approach. Some people call it the endonasal approach, and the reason why is that the incision is on the inside of the nose. I've been doing rhinoplasty for almost 25 years, and in about the late 90s, I opened about half of my noses and did about half of them through a closed or endonasal approach. What I've come to believe, with a lot of experience, is that if you can do the procedure through an endonasal approach, which makes up about 95 to 98% of our patients at this point, I think it's better for the patient. I think there's a much more long-term result. The reason why is by not making the incision at the base of the nose and taking all of that tissue off the nose, it's much less traumatic. What I use is what I call a balanced approach. In other words, structural reorientation. What do I mean by that? If you look at a nose that is well balanced, it looks smaller. In other words, years ago, doctors used to take out a lot of tissue, take the hump down, turn the nose a little bit. But if you just take a look at a lot of the subtleties, and if you look at our patients in our videos or our website, changes in the nostril, so the nostril becomes less apparent. Changes in the tip projection, so that the tip leads to dorsal. Those noses are now more balanced and they fit the patient's face a little bit better. Why do I like the endonasal approach? What we do is we're able to get through with experience, fiber optics, good lighting, and very small instrumentation. We're able to do the rhinoplasty through a smaller incision, which is much less traumatic. The other thing is I don't put a lot of packing in the nose. Using a structural reorientation or balancing by bringing things back in alignment, there's less dissection for the patient. So I don't put a lot of packing, and I put a light dressing in each nostril. And that dressing comes out the next day. We have a lot of these photos on our website, but in my opinion, a structural reorientation or balancing of the nose through endonasal approach is much more predictable and a much easier procedure for the patient. I did write a book on rhinoplasty, and it's right up here. You can find this on Amazon, and the proceeds go to domestic violence. And there are a lot of frequently asked questions in here as well that you could answer. So thank you for watching, and I hope that answered some of your questions on what do we mean when we talk about a scarless rhinoplasty.